Well, good morning, everybody, and welcome to Central and Southern Ohio HIMSS Chapter Conference for our fall conference. This year, we have a fantastic lineup of guests and speakers to introduce you to, but I want to start and thank you all for joining us this morning. I know in this era of COVID, we're all dealing with lots of Zoom meetings and lots of conversations that are all distract us from professional development and events like this. So I want to thank you all. I want to first start too, and just a brief introduction, and thank you to our board who helps us make this possible. As you guys all know, we are a volunteer board, and we've got a great group who've been really excited to bring this conference together to help you guys understand what else is going on in healthcare. And you guys know our conference theme today is Digital Health Ohio. And so as you learn more as today goes on about the things that Ohio has been doing to revolutionize the way we conduct healthcare in this new digital era. Today's agenda, we have a packed agenda. So we're going to try to keep things moving fairly quickly, and I will talk as little as possible. So I won't spend time on the agenda today. Just know, if anybody has trouble with Zoom or this webinar or has questions, please feel free. You know, this is the challenge I think we all face with Zooms and these kinds of things. Everybody's getting used to putting chat in the and Q&A in the inside Zoom. So feel free to make this as engaging as possible. Ask questions. This is a little challenging to run the tech side and give the presentation. So please feel free to ask questions and put comments in there, and we'll try to respond to those as quickly as we can. And I do want to thank our sponsors this morning. Thank you so much. We've got a great group of folks that have been able to step up and help us bring programs like this. This brings CEU credits for all those who are CPHIMSS and others. So this is a great opportunity to capture some of those CEUs, and having conferences like this, believe it or not, still costs our organization money. And so our sponsors help fill that. But they also bring some perspective in healthcare, help us with some of our guest speakers. So want to thank our program sponsors. And I think we've got, yeah, there we go. Our platinum sponsors. Our platinum sponsors who contribute to our organization in not just financially, but also often with helping us with the program. As I mentioned, helping us with some of those guest speakers and others. So thank you guys very much for our platinum sponsors. In addition, our premier sponsors. So thank you guys very much. Appreciate that. Our elite sponsors. And all right. We also wanted to announce, pretty excited, our scholarship program has continued to grow and expand and evolve, but we've decided to expand that to the high school age. We're seeing more interest in healthcare careers, and so we thought it was very appropriate to start opening up our scholarship opportunities to high school students. So we're really excited about that. Our scholarship chair, Donna Evans, helps lead that. She's done this for many years and has great connections throughout our community to help bring some of those scholarship opportunities. And we're really excited to include high school students as well. A lot of great interest from that group who's starting to explore careers in healthcare. All right. With that, I'm going to kick us off here, and then I'm going to turn this over to Ajay for a bit for our introductions as we go. So I'm trying to keep paying attention to the chat. But I will start us off with. So over 18 months ago, I think we all felt that this pandemic, or many folks felt that this pandemic, we all heard stories of could last anywhere from 3 to 6 months or over 18 months. Well, here we are, we're in the over 18 months, and we're still working through a pandemic. Hopefully, we can all say soon, we'd love to be taking masks off and be able to start having more meetings in person. and get to know everybody a little bit better again, instead of being in our homes and all working remotely. So, but in Ohio, what we've seen is organizations and healthcare really starting to advance digital opportunities, connecting with patients in different ways, trying to engage in this remote world of healthcare. Yes, patient care often requires hands-on, seeing wounds, seeing, and everything else in healthcare where you need to be physically there. But we've seen telehealth and other examples. You guys heard back in the spring conference, a lot of opportunities in telehealth, and we're all starting to learn more about what it means to be more digital. So really excited that we're able to bring this conference to you this fall. And with that, I'm going to turn this over to Ajay. So thank you everybody again for joining us this morning.
Great, thanks, Alex. Don't know if you can see me or not.
No, hang on one second.
I don't know if I'm on video or not. There you go. Wow. All right.
All the power.
Well, I appreciate the opportunity to, again, always, volunteering with HIMSS is amazing. I've been a board member of the Central Southern Ohio chapter now. I think it's 14 years if I have to think back. So, it's a passion, and love doing, putting together the conferences, the networking sessions, being able to engage with so many of you, to educate, to collaborate. There was something that, the organization that I work for, we had some, questions on a particular area, and we reached out to another organization based on some contacts we made through HIMSS. And they were able to share some of the challenges they faced with the same, issue we had, and we're able to come up with a solution. And I'm happy to say I was checking back with our team earlier on yesterday, and it's great. It solved our situation. So, I really believe that HIMSS can make a difference. One of the things that I want to be able to do, and it's my honor and pleasure, to be able to introduce before our keynote at 9 o'clock, the President and CEO of HIMSS, Hal Wolf. And Hal has been with HIMSS now for, I think, a few years, about five years or so. And HIMSS is, it's got a membership of 80,000 people around the world, and has operations in North America and Europe, United Kingdom, the Middle East, and Asia. So Hal, I know, is respected internationally as a healthcare and informatics leader, with areas of expertise that are in mobile health, mHealth, product development, integrated care models, marketing, distribution. I mean, a whole wealth of knowledge that he brings to HIMSS. And I know before joining HIMSS, he was a director at the Chartist Group, and a practice leader in digital health strategy. So, brought with him that, as well as a senior vice president at Kaiser Permanente. So I know there's a lot of respect for Kaiser across the United States, and he's held executive positions in organizations like MTV Networks, Time Warner, and also as a senior advisor to McKinsey and Company. And I wanted Hal to join us today and share a little something about HIMSS, the organization, and some of the things that we've been doing at HIMSS. So hopefully, Hal, I don't know if yeah, I can see you. There you go. Great. Well, welcome, Hal.
Thank you, Ajay. Appreciate it.
Thank you so much. I don't know if I can stop. Let me see if I can stop my video and give the floor to you. There you go.
It's better either way, I'll tell you. It's good to see you. Thank you so much for inviting me. And thank you, everyone. It's amazing to be here at the Central and Ohio HIMSS chapter. I love getting out to the chapters, wish could be there in person, and I will all be looking forward to that fairly soon. Let me go ahead and if I can, I would just love to give a quick update on what's going on at HIMSS. We have so much in motion. And Ajay, we're actually up now to over 110,000 members globally.
Wow, that's pretty
that
cool.
much during the pandemic. And we haven't put too much of a spotlight on it, but tremendous growth in Europe and in the Middle East. We've been maintaining and growing our membership in North America as well. And it's just been an exciting time to be a HIMSS member, and there's so much going on. I think about 3 years ago, we shifted our vision, as you know, to realize the full health potential of every human everywhere. And that has really spoken to a lot of people, because if there's one thing that the pandemic has put a tremendous spotlight on is the equity challenges that we have all across the globe. And HIMSS, with its resources, its focus on standardizations, its government relations and services, has really been called upon, whether in the US or the EU or in Asia, to really help bring all the expertise that is a culmination of our membership coming together to develop those standards and those maturity models. They're being adopted everywhere. We're in a rigorous program now. We'll be measuring every hospital in Germany. We've won the tender to do so before and after their equivalent of meaningful use. We're doing similar things in France. And of course, right here in the United States and around the globe, we've been launching the digital health indicator, which gives us an opportunity to really look end to end at the capacity of systems as well as individual hospitals and clinics and their readiness for digital health. So that's just moving along great. And it ties into our whole mission to reform the global health ecosystem through the power of information and technology. And we took that apart. It used to be IT, but of course we all know in our roles that it's really the information that we derive from the technology, and now a whole new advancement in technology and how it's going to impact the patient at home. So HIMSS continues as a really great global advisor. I'm just so honored to be able to lead it. Our thought leadership, and just remember, this is a member-driven society, and it's committed to transforming the health ecosystem. The strategies just got reconfirmed recently at the board of directors meeting just a week and a half ago. And that membership is all about, number one, membership value. It's our number one strategy. We're working so hard to increase the value of membership that we deliver, putting in new membership support systems. You'll hear more about that this coming year. The thought leadership, another key strategy, because the global market keeps asking for it. We continue to take our maturity models and expand them and really give them that breadth and that depth. And they are being adopted worldwide. And a lot of innovation. We're really recognizing, of course, and you all see it every day, that outside in, our CXO seminars, our opportunities to engage with individuals and think about the next generation in the use of machine learning and AI and what that's going to mean from the information standpoint, feeding back into our systems. It really is turning into an outside-in environment. And of course, expanding globally. I mean, we've been working on this for quite a while, and we have grown in the last 4 years. And I was fortunate enough to come on 4 years ago in September. We were just short of 70,000 and now over 110,000 members globally. So you're part of a really big family. And we're going to continue to grow internationally. We're going to continue to see, I think, internationally, and I think this is an interest to so many people, in effect, their meaningful use in the EU has started. The EU is pumping billions of euros now into the healthcare systems in their marketplace. And it really is like a mini meaningful use. So we know what that means. We know what the challenges are going to be across Europe, and HIMSS will be there to help. So we have a real strong foundation. We're just so excited that we've been growing the way we have. And we also introduced Accelerate this year. And I hope you all have had a chance to download it. If you go into your Accelerate in either the iOS, or the Android shop. Accelerate is that multi-purpose built platform that we introduced at the global conference. And it really allows you to have connectivity 365 days out of the year, talking to your peers, thought leaders, professional development tools, certifications are in there. You can start to take classes. And this is all just since July when we launched. And really, we think about Accelerate in the end as being the real focal point for professional continuing education and connectivity. And that's going to be pretty exciting for us. We're looking forward to all the growth and membership. And when we put it together, and I know the chapter leaders know this, we really had a specific roadmap and thinking about HIMSS chapters as ultimate users sitting on Accelerate, because it gives you all these network tools. It's vibrant, it's diverse. We have a global community on health professionals and institutions. HL7 has made it their home, so we're developing the developer community there, as well as certifications and training with HL7. ACHE, the American College of Healthcare Executives, is now on Accelerate, and it's actually open to multiple associations and, of course, individual chapters. Your chapter has a place on Accelerate where you can go in, get registered, and begin to communicate privately, personally, and of course have a great place to congregate. So we're really excited about that. From my standpoint, and Ajay, you and I have talked about this previously, but to me, the heart and soul of HIMSS is everything you all do. The chapter level is where we are. It's our ability to share with each other, just like the amazing keynote that's coming up on thought leadership, both with Chris and Ed that are coming up right behind me, but also this incredible ability to share best practices from around the globe and influence what best practices are back out. We're in an era of change and speed and change management we've never had in healthcare before. And I really think that as we can do a better job and always continue to support the work you all do at the chapter level, and then continue to grow and influence care, we're going to leave everything behind us better than we originally found it. And for me, that's the end state. That's the wonderful goal. So AJ, I just want to say how grateful I am for you and all the chapter leaders. Thanks for having me this morning. If there are any specific questions, I'm thrilled to answer them. But thank you for all your hard work and making time to allow me to come in and say hello this morning.
Well, we definitely appreciate it, Hal. I know getting time on your schedule isn't easy, and I think we're fortunate that we were able to do it. One of the things that we have. So for folks that are not on our boards and part of the regular chapter meetings, we have chapter leader exchange, where chapters around the country and now around the world, get together and exchange ideas, connect with each other, network. One of the things that you said in our last leadership meeting, very, very similar, but just the mission and vision has constantly evolved for HIMSS. Definitely, and being able to, one of the things that I was heartened about is, my family's originally from India, and I know that HIMSS has, started to grow in that country, and having family still there, working with paper charts, makes me think, we did so much a decade ago in the United States to get us off paper and onto electronic medical records, and being able to, move so far forward with interoperability was, I think, something that HIMSS was able to move the needle as an advocacy organization. So I think that's part of, to your point, how we're able to engage and collaborate.
Thank you, first of all. And of course, whenever we see that needle move, this is a collective effort. It comes from all the expertise of all the HIMSS members through the years that have contributed to getting those standards and those thoughts directly. The India chapter in particular, if I can, Ajay, is to say, it has grown tremendously. I personally went there and worked with the chapter and had a chance to speak with the leadership multiple times over the last couple of years. They have gone on to the Accelerate platform. They've grown over 150 members in literally since July, making that their home. And what many may not realize is that the chapters from the legal structure is in 3 countries, the United States, Canada, and India. Everywhere else, there are communities. And we are just seeing tremendous growth. And to your point, India is a huge market, and they are beginning now to really digitize. And so the frameworks and the interoperability standards that HIMSS has been able to support in conjunction with the global consortium on interoperability that we have in conjunction with IHE and HL7 has really had an influence. So, again, everything everyone does, all the advocacy, all of the hard work that everyone contributes on a volunteer basis, you're making a difference in the world. You really are making a difference in the world. And I think that's what makes our society so special.
Yeah, great. Alex, any thoughts on your side?
Yeah, Al, first I want to thank you again for joining us this morning. It's interesting. I think, I've been part of HIMSS now, I think back to the early 90s. And, the organization has grown tremendously. HIMSS has done a great job trying to keep member services and member value in front of everybody and how to get engaged. Are you seeing much in terms of those folks getting engaged outside of their own countries? So to that point, what can we learn from other countries, and who's ahead of the US, who's behind the US, and how do we support them, and how do we bring this kind of global healthcare approach?
Yeah, it's a great question, Alex. Thank you. It's a mix. The United States is a very unique system, if you want to call it a system, right? So, but it's unique, and it's unique because our funding model traditionally has been so privatized, and then you have the government piece, and now in the government funding in the United States is about 50%, and it's going to continue to grow, and it'll take on larger and larger. And I'm part of that silver tsunami, that's coming in for a landing in Social Security in the next few years, and be a part of it as well. I think where we are seeing the biggest change is that meaningful use in the United States gave us an incredible acceleration over most of the world. And they finally have gotten the realization, looking back at the States, that this is something that can be done assertively and can make a positive difference. Here's the big difference. The big difference with other countries is that they have been seeing what we did, figuring out how to narrow the path to get the most out of their initial EHR components bringing forward. And they're really already thinking outside in. So where we did our solidification of EHRs on a broad scale, which is really an inside out delivery of care, because of their great focus on social care and social determinants, they are thinking even more outside in. And they're building it into their first generation, both on a data architecture standpoint, as well as how they think of the technology. And so working it through with them and seeing that and running it through the digital health indicator at scale is really helping them streamline what we kind of learned as we went through that growth and metamorphosis. There's always a benefit of going second, right? But overall, I would say the US continues to deliver great care, but our challenges will remain access and equal quality as best we can. And I think that's the challenge all around the world. And we just have to keep focusing on it. And digital health will be a great contributor to that equality.
Yeah, thank you for that. That's great. And I think the more we learn from each other, the better off we're all going to be.
Well, we're going to set up a whole series of mentorships and cross efforts so that communities overseas can get hooked up with and partnership with chapters in the States. We're looking forward to having exchange programs if people are up for it, where maybe someone from overseas comes over from that chapter for a month, and this chapter will send someone over to a community in Europe. We're really expecting that to take off in this year and those plans. We've been talking about them a little bit. Obviously, something got in the way over the last 18 months, but the United States opens up on November 3rd. And so we're actually just now starting to be able to go back and starting getting those personal interactions back together again. So we're really excited about it.
Nice. All right. Well, Hal, I appreciate you joining us this morning.